What's up, my friends? Today we're going to cover the first part in a series of 3 parts on the ankle. So, in this first piece, we're going to cover the mobility aspect. So, mobility refers to the range of motion you've got available, both it refers to the joint mobility, but also the soft tissue mobility, which we know as muscle tendon units. So mobility is the first part. Then in another part, part two, we're going to cover the stability. So the very basic fundamental pieces of getting your ankle stability back, which is going to be really important if you have a history of ankle sprains. And then in part three, we're going to cover the higher level strengthening plyometric pieces of strengthening that ankle. All right, so let's get started on mobility. Always want to make sure you've got good mobility. If you have hypermobility, meaning you've had that history of ankle sprains, usually it's in the direction of a lateral ankle sprain. So, in other words, your foot turning towards the inside. And if that's the case, you still want to work on your dorsiflexion mobility. We're going to talk about what that is in just a second. So, most people with poor ankle stability or a history of ankle sprains have poor dorsiflexion of the ankle. So, you would still want to work on these motions. The only one that may give you problems is when you're trying to stretch the front of the ankle. So, I would just stay away from that one. All right, so let's cover directions first. This is good to know for the ankle. The motion that I'm doing here is called dorsiflexion. This motion is called plantar flexion. So this is important when we talked about ankle sprains. People that have a history of ankle sprains, usually the outside, usually you sprain it going this way. So they usually lack motion in this direction, ankle dorsiflexion. So good to use. And I'm going to show you the first now mobility exercise we're going to do. I'll show you from 2 views. This is the front. I'll show you from the side also. But what you want to do is find a bench, something like this ideally. And then you're going to have your heel hanging off. And what you're going to do is passively use your upper body strength. You're going to push that heel down towards the floor. And you're going to do reps. You're not going to hold it. You're doing reps. And you can usually, you need to push really hard. You're going to feel this in one of 2 places. One, you could feel it in the front of the ankle. Alternatively, you could feel it back here in the Achilles. Either one is fine. Just work to push that down. Let me show you from the side. It's going to look like this. So you're pushing heel down, driving it towards the floor, and I'm mostly using my upper body, and I'm not holding it. All right, that's number one, especially again if you have lateral ankle sprain history or ligamentous laxity. Someone might say you've stretched your ligaments out. Same thing. You want to work this motion. Now, because there's 2 motions, 2 muscles that make up your one Achilles, here's the other stretch. You got to get your knee straight. And we're all usually familiar with this one. This, again, you want to ideally drop your heel down below level. Show you from the side. So you're here, you're dropping it down. I notice my knee is straight over here. And this one you should really feel more up here in the muscle belly, maybe in the upper Achilles. Now, some options you could do, and I would play around with how much you have your foot turned out. You can get a little different angle there versus turned in just a little bit versus really straight. Find the most limited direction, I would say, and work on that. Same thing with this one here. You can work a little bit in, a little bit out. All right, so there's those first 2. Third one, this is going to be the one that if you have had ankle sprains, you might want to be cautious with or even avoid this one. But otherwise, this one feels fantastic. It's a good fascia stretch. Sometimes you're getting these peroneals out here, these everter muscles, they're also called on this stretch. So what you do here, hand over the heel, nice strong pressure. I'm putting like most of my weight over that arm, rolling it out, rolling it in. If you have knee meniscus problems, you might be feeling this a little bit too. It involves some rotation in that knee. So be cautious with that if you've got some knee meniscus problems. Rolling just in and out like this, that one feels fantastic. Next one, what you can do is just flip over to the big toe. So big toe is underneath, and then you're gonna roll this one in and out. Now this one you could do if you have history of ankle sprains. This one should be fine, should be good. Try to find any areas that are particularly tight and just sit on those. But I'm rolling it, I'm not really holding it very long. Okay, now last one. I've got a little ball here. This is pretty firm, pretty hard. So you can use anything that's pretty firm, pretty hard. The size or diameter of it is going to matter too. But this is really helpful for just getting blood flow in there, especially before you're doing a workout. So what I usually start with is just moving around, get the inside, especially right in here. There's an important blood vessel that comes in and feeds that plantar fascia. Often an issue with plantar fasciitis, so-called plantar fasciitis. It's not really an inflammation problem. It's a tissue death problem. So we'll do another video on that, I'm sure. Also, if you have bunions, you know, where your big toe is starting to drift inward, I'll do another video on that too. You can check that out. But for this one, you're rolling around getting blood flow first for maybe 30 seconds. And then what I want to do is find any tender areas and then work the toes up and down while on that slightly tender area. And I don't have much of my weight over here, maybe like 20%. Most of it's on my back leg. And do maybe 5 reps of that. Find another spot. Got one there. Boom. Hit those toes. Open and close. Open and close. All right. Good. Hopefully that was helpful. And then remember, I'm going to hit you up with part 2 on getting the stability of that ankle, which is super important if you have that history of ankle sprains. All right. See you on that one.